Welcome to Friday morning at ESOF. I'm actually sitting in the London office of the Lancet, one of the world's great medical journals, with its editor, Richard Horton, who has been one of the most trenchant and concise critics of British and indeed the global response to COVID-19. He's brought out a book, The COVID-19 Catastrophe, which I think you finished writing in May. We're 3 months further on now, Richard. How have things panned out? You were very angry, to put it mildly, furious with the responses of several countries, particularly the UK and the US and other European countries in this book. Have your thoughts, your feelings mellowed at all? Or do you think it's just as bad as you did when you wrote this book?
Well, thanks, Clive, and it's great to be here with you. I should say it's only my second time back in the office since lockdown began in the UK back in March. The epidemic has evolved, and I think we do have reason to continue to be, if not angry, then certainly anxious about the evolution. The spread to see major foci in the United States, across Latin America, in India and in South Africa, those 4 areas especially, should give us reason for very, very serious concern. This pandemic is not over. It is still raging around the world, and we are still at very, very serious risk. And I don't believe that we've fully learnt the lessons.
And of course, putting the human face on it, in the last 3 months, the number of people who have died from this dreadful virus and the number who've been made ill is vastly greater than it was when you wrote the book, isn't it? It's raging away.
Yes, exactly. And I think that human dimension to this pandemic is one that we're very much in danger of losing. We focus so much on league tables, on death rates, on comparing one country with another, but behind every table are families who have lost loved ones too early, and that's the reason you said at the very beginning that the book was angry. The reason why I think we should be angry is that most of these deaths were entirely preventable, and we should retain our ability to be shocked by the brittleness of the societies that we live in, and that's why we have to learn the lessons from this pandemic.
Well, let's look at how it could have been stopped in brief, because there are many ways where the interventions could have been better. Let's start at the beginning, December 2019 in China. Could it have been stopped in China and not got out to the rest of the world at all, do you think?
I don't believe it could have been stopped in China. One of the unfortunate realities is that Wuhan is a major transportation hub for Asia. And if you look at Gabriel Leung's work that we published at the end of January, you can see that was in some ways about the worst possible city for the outbreak to begin, because the spread across the whole of Asia was dramatic. We certainly knew the earliest documented case that I'm aware of was December the 1st, 2019. And we certainly know that in those early weeks when Chinese doctors and scientists were struggling to understand what was happening, sure, if there had been 1 or 2 weeks shaved off the first reporting to WHO at the end of December, then it's possible the burden of infection could have been reduced coming out of Wuhan. But I don't believe that it could have been stopped entirely. No, I think that would be a pipe dream.
Yes, I mean, I think there's reasonable evidence, though it's not conclusive, that there were already people travelling infected out of China before anyone recognised it, even the Chinese.
Yes.
Because we have to remember that it is an exceptionally transmissible virus, as well as being virulent in a minority of people. It's very, very transmissible, isn't it?
That's right. And I mean, we know that now. And it's interesting to try and rewind one's thinking back to December and January. And, you know, in January, we really weren't sure, was this human-to-human transmission or not? But it did become very clear by about the middle and late January that this was human-to-human transmission. But even then, I don't think we realised just how transmissible it was. And of course, again, the science has evolved. And in particular, the two dimensions that's really made this whole pandemic more complicated, the asymptomatic spread, which we were aware of the dangers very early on, but we didn't have a handle on how big a part asymptomatic spread was going to be. And secondly, the importance of airborne spread. And I think, again, the traditional public health science, epidemiology, you needed a different kind of science to understand the notion of these microdroplets, these 5 mu microdroplets that literally are suspended in the air, and that poses an additional danger. So again, the science has been so important to understand the transmission dynamics, but it has changed, and that's, as you rightly say, we now know that it is a much more transmissible disease, much more severe disease than we thought.
Okay, China couldn't have stopped it, I agree with you, getting outside their own country, though they could have reduced the burden probably. How well did the rest of the world react in the early stages, let's say to the end of January, when the World Health Organization declared a public health emergency of international concern? How well did the world do in January?
I think the conclusion of history will be that the world did very poorly. And the reason for that, well, there'll be many reasons to explore for that. But fundamentally, I don't think that governments understood what a public health emergency of international concern actually meant. And maybe that's actually a fault of the global public health community, of not making that clearer. Because the one lesson that we learned from SARS 2002-2003 was that we needed to strengthen the international health regulations, we needed this public health emergency of international concern red flag to wave, we needed to invest the power in the Director General of the World Health Organization, and that meant that when he or she pressed the button to say this is a public health emergency, governments were supposed to spring up and react dramatically. And they didn't. Nobody did. And that was a shocking misunderstanding of what AFAIC actually meant. So that, unfortunately, the fact that although on January the 30th, a public health emergency was declared, and then nothing really happened until early March for most countries. And that was wasted time.
Yes. Do you think the World Health Organization and Dr. Tedros in particular were too reluctant to call a public health emergency of international concern because of wanting to keep China on side, collaborating?
I think this is a very unfair accusation that's being levelled against WHO. You've got to think about the situation at the time. The Beijing office of the World Health Organization was doing their level best to work with Chinese colleagues to understand what on earth was going on. I mean, nobody fully understood what was going on. I mean, they were sitting in Beijing, this was going on in Wuhan. It was a brand new virus, a brand new disease. Everybody was really struggling with information. And then Dr. Tedros called the International Health Regulations Emergency Committee together. Absolutely the right thing to do. And when the committee came together, they were evenly split about whether there should have been an emergency declared or not. Because there wasn't enough information. We're talking about the middle of January. There wasn't enough information. So then he could have called an emergency after the first meeting. But, that's knowing what a big deal it is to call an emergency, he wanted the support of the emergency committee. And these people sitting around the table in that committee were world experts. So he waited, and he then went to Beijing to try and understand what was taking place himself. And then there was the second committee meeting. And as soon as the information became clear, he did the right thing. So I think actually, and if you compare the speed with which WHO declared a public health emergency this time compared with Ebola, I mean, this was unbelievably fast. So this is why I think it's very unfair of certain governments to be so critical of WHO and Dr. Tedros. I actually think WHO did an amazing job under the circumstances.
Well, before we go back to what happened elsewhere in February, let's pursue the WHO line. Do you think the WHO has continued to do a good job since the end of January? I mean, is it still working as it should, despite, as you've indicated, certain governments sniping at it?
I would say less successfully. So firstly, they've done an exceptionally good job at producing technical briefings on a daily basis. I think Dr. Tedros has led from the front and has given warnings at the appropriate moments, and rightly so. However, I find it utterly incredible that even today, as we're speaking, there has not been a moment where the countries of the world have been convened to try and carve out a global approach to this pandemic. There was the World Health Assembly that was a brief one or so day affair in May, but nothing particularly serious was discussed or agreed at that meeting. It was not an attempt to forge a global response to the pandemic. And since then, certainly nothing has happened. I think what should have happened, and certainly this is a little bit of hindsight, but it's actually an important lesson. As soon as the public health emergency was convened, in the first week or the second week of February, there should have been an emergency meeting of the UN General Assembly. You can call an emergency session of the UN General Assembly when there's a threat to international peace and security. That should have been led by Antonio Guterres. WHO should have been absolutely central to that so that we could forge a global response. What actually happened was a public health emergency was declared, and then 195 countries around the world had to have 195 responses. And they were literally left on their own without any coordination. And I think in retrospect, that was a grave mistake.
Do you think now, August, September 2020, there's still time to revive a global approach, a coming together? Or has that moment passed?
No, it's definitely not passed. And indeed, it shouldn't just be one moment. There should be a rolling process now of global cooperation and coordination. We have this virus raging through Latin America. Destroying economies. And we talk about schools in the United Kingdom. Think about a generation of children and young people across Latin America whose futures are just being completely wrecked. Some of the highest death rates in the world. A real catastrophe. In the United States, we're going into an election cycle. There'll be a new government in November. Almost the whole of Capitol Hill will be cleared out, new people coming in. They're going to need international support and cooperation to help guide the US response. Still in Africa, we're seeing the epidemic rage through the continent. We absolutely need to have a way to have better global cooperation, and it needs to be done through WHO. So what I think my plea to Dr. Tedros would be, we need, if we're not going to get an emergency session of the General Assembly, we need an emergency session of the World Health Assembly, and we need it as soon as possible.
Yes, you know Dr. Tedros better than me, but I think he's been quite wounded by all the criticism, and he may not be bold enough to do what you suggest.
But he's got, I think that may well be absolutely right, and he may well be advised. WHO is a very conservative organisation, and he may well be being advised not to do something like that. But he has enormous goodwill. He has the entire medical global health community supporting him. And it's the right thing to do. There's no other way to manage a pandemic than through a global response.
Yeah, absolutely. Anyway, let's now step back to what individual countries did, as opposed to the failure to have a really good global response. During February, as you've said, many countries, including the one we're in now, did very little. Why was there that level of inactivity for a month after the global health emergency was declared?
I think two reasons. The first is that although a pandemic was top of pretty much every Western country's national risk registers, the pandemic that was planned for was influenza. And of course, influenza is a very nasty disease, but it varies from year to year, but roughly has a mortality of about 0.1%. And that is usually absorbed in the population on an annual basis, and certainly doesn't pose any major threat to the capacity of a national health system. And I think people were thinking through the lens of influenza. And that was clearly wrong, because we knew in January that this was not influenza. So what I find very strange is that people did not pick up the fact that this was a SARS virus, that all the models for pandemic preparedness were therefore wrong, and had to be recalibrated. I think the second reason is equally unfortunate. I just don't think people understood or even believed the evidence coming out of China. And that is mysterious. Everything that has happened, Clive, in the last 6 months was clear from the work that was in the public domain at the end of January. Everything about the importance of personal protective equipment, the risks to schools, test, trace and isolate systems, the dangers of asymptomatic spread, everything that we've been debating and struggling with, it was all there. And if people had read that work and thought about it and contacted Chinese counterparts, one of the advantages about China's system is you can literally count on the fingers of one hand who the key people are. George Gao at China CDC, Chen Wang, president of Chinese Academy of Medical Sciences, just those two people on their own who speak fantastic English, educated in the West, brilliant scientists. They would have told them, any government who contacted them, you need to prepare.
Yes. Who responded well? I mean, in terms of the sort of narrative that's developing, the East Asian countries that were more affected by SARS responded better. And within Europe, Germany is getting good marks still.
Yes, it is. It is. Certainly Jacinda Ardern, I know New Zealand's going through a recrudescence right now.
But on a tiny scale.
That's right, on a tiny scale. But she did very well. And her attitude, I think it's an attitude of mind. I mean, when she said, we may only have 100 cases, but Italy had 100 cases at one point, she got it exactly right. You have to act. I mean, at the early stage, we can't have the same kind of lockdowns in the future, and maybe we'll talk about that. But certainly at the very beginning, when we didn't know very much about the biology and pathology of this disease, it was the right thing to do to act decisively. And she understood that. And many governments didn't understand that. They thought that they could somehow push it away, and it wasn't going to affect them. Germany is a very interesting case study because, I think the honest thing to say is we don't fully understand everything about this disease, and it would be a very unwise person to give confident judgments yet about why one country has done well and one country hasn't. So I don't want to be that person.
I'm going to throw in the word luck here.
Yeah.
To distract you.
There may be. But I think there's one thing about Germany which is very interesting, and there's maybe a lesson for us here. Germany has a very illustrious history of laboratory medicine. And there is a very decentralized laboratories system across Germany, something like 170 odd labs that are a network of laboratories which are able to do the testing and the monitoring of an outbreak. In this country, we have fantastic public health expertise, but we don't have the same decentralized laboratory capacity. And that meant that we were not able to have that testing capacity that is so essential in the early part of a pandemic. We're talking about it now, but you need it in the early stages of a pandemic so that you know where the virus is and when you need to be acting decisively, whereas Germany did have that capacity. And I think that may be a lesson for us, that actually the capacity and the decentralization of laboratory services might have been the critical factor in Germany's success.
And the Robert Koch Institute gets credit too.
Absolutely. You know, the Robert Koch Institute is a fantastic jewel in the crown of European medicine, and has just demonstrated stellar leadership.
When, for some European countries, it was only taken really seriously, I think, when the disease hit Italy first hard, that's galvanized people too late, didn't it, in
Yes.
some other countries?
Yes, and I mean it was, and certainly I know the story in the UK perhaps better than other countries, but it was only when the death rates in Lombardy were, and the admission to intensive care in Lombardy became crystal clear that the various pandemic models were revised, and when you doubled the intensive care unit admissions, then suddenly the whole NHS just collapsed. So, and that information became available in early March, around March the 5th. So I would still contend that we didn't have to wait until the Lombardy data, because the data was already there at the end of January, so I still would maintain there was a 5 or 6 week delay. But then, March the 5th, the models were changed, and then we still didn't lock down until March the 23rd. So we then wasted another 2 weeks, over 2 weeks, when the virus was literally doubling every 3 days in terms of its transmission. Now that was what led to the catastrophe in the UK. So it's two-phase catastrophe. We ignored data in China for 6 weeks, and then when we did wake up, we then waited another 2 weeks when we shouldn't have done. And that actually was not just a UK failure, that was a failure that was mirrored across pretty much every Western European country.
Yes. And then the US is another case again, and we should mention the US because it's the world's powerhouse of medical science, but not of public health, apparently.
Well, you know, the US actually has, in the Centers for Disease Control and Prevention, the preeminent, I've just said Robert Koch Institute's the preeminent, Robert Koch is the preeminent Western European Public Health Institute, or one of them, but CDC is an incredible institution. But CDC has been eroded over recent years through various budget cuts and a political climate that has been very much to the detriment of having an agency that can really call out when there's a concern. So you know, the US is it's a paradox. It is the world superpower in science. Second to none, and yet has, because of its libertarian political tendencies and the lack of any public health system whatsoever, it's just completely failed and is continuing to fail.
Before we talk about what happens next, second waves, or whatever you call them, I'd like to ask you how you think the world of science and medical science has performed, distinguishing it slightly from the political public health response, because as the editor of one of the leading medical journals, have you been impressed by the outpouring of research?
Well, I've never seen anything like it, Clive. And actually, I must say that I have nothing but pride, actually, for the way that the international scientific community literally dropped everything and has responded in a coordinated fashion, actually. You know, governments may not have been coordinated, but the scientific community has done an unbelievable job. I mean, remember, we didn't even know this virus existed until the beginning of this year. Yes. And in the space of 6 or 7 or 8 months now, I absolutely agree that there's still an awful lot that we have to learn, but what we have learned is remarkable, and the scientific community has done an amazing job. I mean, of course there have been missteps, and of course it would be nice to be more certain about particular decisions. It would be great to have certainty about schools, about transmission in children, and so many questions still remain. But actually, it is probably the greatest scientific response to a threat that we've seen. It surpasses even the response to HIV/AIDS, which itself was stellar.
And just on a more sort of closer to home note, how does a journal like the Lancet cope when you're presumably overwhelmed with papers? How does the peer review system stand up, or does it not?
Well, I think there is a cost. And the cost has been, and of course this is the cost that we've seen mirrored in health systems, we've had to drop other things. You know, at the very beginning of this year, we had a plan that we were going to use 2020 to campaign on children's health. We launched a commission at WHO in February with Dr. Tedros called Future Child. And then everything went pear-shaped, and we haven't done anything on children from that commission this year at all. And you can mirror that across other spheres: cardiovascular disease, cancers, other infectious diseases, and so on.
And particularly mental health.
And mental health, absolutely. You're absolutely right. And so we have really, this is for the weekly journal, we have really struggled there. Now, the thing that I'm very grateful for, and I don't want to plug the Lancet journals here, but we have a stable of about 20 odd journals, and we do have a Lancet journal that's focused on mental health, a journal that's focused on cancer, and so on. So we have been able to keep attention on these other issues. But for the weekly journal, it became for 6 months a COVID journal. And of course, it's right that we should do that in the middle of a raging pandemic, but there are other issues that we should be turning our attention to beyond COVID. And that's my concern. We mustn't lose sight of, you know, COVID is an acute on chronic crisis. It's an acute pandemic which is hitting a world that has a series of chronic conditions, some of which are health-related, climate-related, poverty. There's a whole set of issues. We mustn't ignore that chronic dimension that the pandemic has rested on.
Turning to the future, first of all, the next few months with COVID, and then we can talk about other pandemics caused by different viruses or pathogens that may be on their way. How do you see the next few months panning out? How do you think governments and the world should respond? And are we likely in the Northern Hemisphere to see a real upsurge of cases, second wave during the autumn and winter?
Well, we're already seeing, you know, the terminology is imprecise, but we're seeing a resurgence in some countries already. We're seeing a resurgence in Israel, we're seeing a resurgence in New Zealand, we're seeing it in this country, we're seeing it in France, we're seeing it in Spain. And of course that's entirely to be expected, because you've got clusters of outbreaks or community transmission still in a population that is largely susceptible. There isn't the immunity in the population to protect people. So it's entirely understandable, as you have further social mixing, that these outbreaks will occur again. And we're not going to get out of that situation, I'm afraid, until either there is sufficient immunity in the population, which isn't going to happen anytime soon, or we have a vaccine. So the race for the vaccine is a really, really, really important objective. I have my worries about that, although there are many candidates, and I think in 2021 we can expect a vaccine, one or more vaccines to be available. No vaccine is 100% effective or 100% safe or 100% given to the population. So the idea that a vaccine is going to be a magic bullet that's suddenly going to turn off this risk is not a reality. So I think that what we're going through at the moment is a renegotiation of our relationship actually with this virus. The first time our species encountered the virus, we did the right thing and locked down. That's clearly not sustainable. And now what we're going to have to do is we are going to have to take responsibility ourselves for how we act in our relationship with the virus.
You mean we as individuals?
We as individuals. This is not something we can lay on government. I think it's fine to be critical of government in the first phase because the responsibility did lie with them. But now the responsibility as much lies with our own individual behaviour. And so we have to manage our own risk. We have to take decisions about how much risk we are willing to take on ourselves. And we know enough to be able to make those decisions. Younger people are relatively safer than older people. Certain jobs are more at risk than other jobs. Certain locations, for example, in hospitals or in care homes, carry greater risk than in other locations. So there is a way that we can use the patterns of risk to inform our individual decisions. And I'm not sure that that message has actually got through yet to the general public, that now it's over to you. Government can't solve every problem. It really is up to each one of us.
If governments, I take your point completely about individuals, but if governments like the UK are to have certain objectives, one of which is not to overwhelm the health service and hospitals with cases, it looks as though that will be relatively easy to achieve because it was so unfortunate originally, the most vulnerable people in care homes. It looks as though, although there are doubts about whether enough people are being tested, etc., the proportion of cases now amongst younger people that are leading to hospitalisation is much lower. Fewer people are dying, and clinicians are learning. Exactly. There may not be a miracle drug.
No, absolutely.
They're learning how to manage the worst patients.
Absolutely.
So I think it would be extremely unlikely. I'm probably positive for fortune. I don't think the NHS in the UK will probably be overwhelmed, but there could still be vast suffering. And we've got to remember one thing that's emerging is the sort of long-term consequences of the disease in people who may not ever get close to death's door. The sort of long haulers. There could be a big burden of disability and mental health issues from this.
Very much so. It's 8 months in, we don't know the long-term effects of infection at all. So there's a lot we have to learn. I agree with you if we're thinking about Western countries that we've learnt enough, and the pattern of the infection has evolved to the point where I don't think our NHS, our health systems are going to be overwhelmed. But there are still many countries where the health systems are being overwhelmed and can't cope. If you look at India right now, we should be very seriously concerned about what's taking place there. Africa, the two major foci of the epidemic are South Africa and Egypt. Well, you go. That's a reason for great concern as the epidemic is still increasing slowly across Africa. And again, in Latin America, people, in fact, one of the incredible things is that people are not able to use hospitals and health systems in Latin America because the systems can't cope. So I think this is again one of the lessons that governments are going to have to absorb. How do we build capacity to respond to a future pandemic? Because this isn't going to be the last pandemic that the world sees.
That's the note on which we should end, with a question. We don't know what the next pandemic will be. Disease X, it's sometimes called, but maybe COVID-19 was disease X and it's going to be disease Y. Likely to be a virus, could be another coronavirus. Presumably, for all the mistakes with this pandemic, we've learnt enough to cope with what may be an even worse, more virulent and more transmissible virus next time. Was that over-optimistic?
No, I think that's very fair. I think everybody is very sensitized now, but I think we do have to realize that the evidence has been over the last 30 years that zoonotic infections that jump from animals to humans, have been on the rise. So that's why people have been saying we knew this was going to happen and why we know it's going to happen in the future. So how do you build resilient health systems, resilient public health systems, global warning systems, and the capacity for countries to work together, either regionally or globally, to be able to address this? There's still a lot of gaps in our system. The international health regulations are a beautiful utopia, but no country meets the international health regulations. So one of the issues and this is why I want countries to come together still so urgently, one of the issues we need to start talking about now is how do we plan for the next pandemic? We need to be doing that now, not waiting till next year or the year after. That needs to be happening now.
Thank you, Richard. We'll pick up on these points now, fast forwarding from late August at the Lancet office in London to Trieste. Thank you.
Thank you, Clive. It's a pleasure.
Thank you.